This is JAPI, and welcome to JAPI Podcasts.
In partnership with Torrent Pharma, by the makers of Nebicard and Telsar Biso, where science meets care.
I am Dr. Rakesh Bhadade. Welcome to this JAPI podcast for July 2025 issue of JAPI, Volume 73, Issue 7. This issue of JAPI has some really interesting articles, including 11 original articles, 3 review articles, 1 point of review, 1 pictorial CME, and 2 letters of correspondence. Let's discuss this in details. The first original article is titled Diagnostic Yield of Gastrointestinal Endoscopy in Patients with Iron Deficiency Anemia. It is authored by Anand Kumar Raghavendra. This was a retrospective study aimed to assess the diagnostic utility of bidirectional gastrointestinal endoscopy in patients with iron deficiency anemia, an often encountered clinical scenario with multiple potential etiologies. The study involved 554 patients who underwent upper GI scopy, colonoscopy, or both at a tertiary care center. Of these, 379 underwent bidirectional endoscopy. Common upper GI finding included gastric ulcer in 20.7% of patients, duodenal ulcers in 9.5%, and esophagitis in 7.4%. Colonoscopic findings showed hemorrhoids in 16.3%, colonic ulcers in 10.6%, and polyps in 6.6% as major contributors. The overall diagnostic yield was 43.6% for upper GI and 52.4% for colonoscopy. Notably, females and those with severe anemia had higher diagnostic yield. Although traditionally endoscopy is often avoided in premenopausal women with presumed menstrual loss, this study demonstrated a substantial yield even in that group. The study supports bidirectional endoscopy in most IDA cases unless a clear etiology is present. Clinicians are advised to adopt a liberal endoscopic approach for timely identification of GI pathologies causing anemia. The next original article is titled Correlation of Neutrophil to Leukocyte Ratio with Severity of Chronic Liver Disease based on Child Tourniquet Pug and MELD-NA score. This was authored by Udit Kandra, Parekh and et al. In this cross-sectional observation study, researchers assessed whether the neutrophil lymphocyte ratio, a simple hematological marker of systemic inflammation, correlates with the severity of chronic liver disease. The study enrolled 16 patients with decompensated liver cirrhosis and analyzed their NLR alongside established scoring systems. CTP or Childcott Pug and MELD-NA. The CTP score was fulfilled by using two methods, bilirubin, albumin, and INR, that is International Normalized Ratio, were noted from medical record registry, while ascites and encephalopathy were assessed using interview and physical examination on the day of patient's admission. MELD-NA score was calculated by an online calculator after collecting data on all patients of serum bilirubin, creatinine, sodium levels, and INR on the day of admission. The significant positive correlation was found between NLR and CTP score, while the correlation with MELD sodium was not statistically significant. The mean NLR values were higher in patients with advanced liver dysfunction. The authors emphasized that NLR, although not a substitute for complex scoring systems, may serve as an accessible and cost-effective prognostic tool, especially in resource-limited settings. It could help flag patients requiring close monitoring and prioritization of interventions such as liver transplants. The next original article is titled White Coat Hypertension and its Predictors in Newly Diagnosed Hypertensive Patients Attending a Tertiary Care Center. This was authored by Muzaffar Naik. This study explored the prevalence and predictors of white coat hypertension in newly diagnosed hypertensive patients in a tertiary care hospital in Kashmir. Sustained hypertension was diagnosed in 143 out of 196 patients, and white coat hypertension was detected in 53 patients. Patients with systolic hypertension had a significant family history of hypertension compared to patients with white coat hypertension. Higher office diastolic blood pressure compared to white coat hypertension and significant non-dipping pattern compared to white coat hypertension. Predictive factors for white coat hypertension included young age, female gender, lower BMI. A negative family history of hypertension predicted white coat hypertension. These results stress the need of ABPM in all newly diagnosed hypertensive patients to prevent overtreatment, especially in those who are younger, female, and lack of family history of hypertension. The study highlights how unnecessary lifelong treatment and its psychological and financial impact can be avoided by confirming the diagnosis via ABPM. Next original article is titled Assessment of Burnout Among Healthcare Practitioners in India, a survey-based nationwide study, and was authored by Anuj Maheshwari. In this large cross-sectional survey involving 673 healthcare workers from across India, prevalence of burnout and its contributing factors were evaluated. Out of 763 healthcare workers, 577 were males, 186 were females. The average age was 43.4 years. The prevalence of personal, work-related and patient-related burnout was alarming 47, 31 and 35% respectively, with 24.9% experiencing all three types of burnout. Burnout was more common among female, younger practitioners, HCPs who spent longer hours a day treating patients, and those with night duties and night calls reported higher burnout levels. A larger proportion of smokers reported work-related burnout. Regular exercise of at least 45 minutes and 6 hours of sleep was associated with lower burnout levels. Additionally, HCPs with anxiety as medical condition were more likely to experience all three types of burnout. In conclusion, this study reveals a significant prevalence of burnout among HCPs with approximately 25% experiencing all three types of burnouts. This raises concern as burnout can have negative implication on healthcare system. The next original article is titled Retrospective Analysis of COVID-19 Patients Admitted to a Tertiary Care Center and was authored by Nihar Mehta. The study's goal was to create a predictive model to predict the risk of death in patients hospitalized with COVID-19. The six selected parameters, that is age, blood urea nitrogen, cardiac comorbidity, lung comorbidity, diabetes mellitus, and elevated WBC count at admission can be monitored in low resource settings and can be remembered by a simple mnemonic ABCDE. The epidemiological, clinical, and laboratory profiles of confirmed COVID-19 patients hospitalized from March 25 to October 31, 2020 were gathered from hospital's medical records department and retrospectively analyzed. A total of 399 patients with COVID-19 hospitalized during the study period were included in the study. The median age was 53.87 and 67.34% of participants were male. The overall mortality was 7.8%. The risk score for ABCDE with cutoff score of 4 had a sensitivity of 67.7%, specificity of 83.5%, and a positive predictive value of 25.6% and negative predictive value of 96.9%. In conclusion, the risk score for ABCDE to predict mortality in patients with COVID-19 during hospitalization is simple, easy to assess, available, economically viable, and easy to remember. Next original article is titled Evaluation of Risk of Allergy to COVID-19 Vaccine in People with History of Allergic Diathesis. It was authored by Dhruvi Soni. The authors conducted a prospective study in 100 individuals with known history of allergy to assess the safety of COVID-19 vaccine Covishield. Participants underwent skin prick and intradermal testing for vaccine components before receiving the vaccine under supervision. Of the 100 enrolled participants, 75 had taken both doses of any COVID-19 vaccine. 15 had taken only the first dose of COVID-19 vaccine and 10 were yet to be vaccinated. There was a positive test with PEG and P80 respectively. Only 2 out of 98 returned with a positive test with a full strength 1:1 Covishield vaccine IDT but not with SPT. In summary, the study indicates an approximately 2% of allergic to Covishield vaccine. Where feasible, allergic testing and counseling can be offered to unvaccinated or partially vaccinated individuals with history of allergic diathesis. Those with allergic diathesis can consider taking vaccine or no boosters in tertiary care centers with ICU and resuscitation facilities. The next original article is Translation and Validation of King's Brief Interstitial Lung Disease Questionnaire in Hindi Language. It was authored by Prakhar Sharma. This study aimed to culturally adapt and validate the King's Brief Interstitial Lung Disease KBILD questionnaire into Hindi. enabling standardized quality of life assessment in native Hindi-speaking patients with ILD. A total of 82 ILD patients participated in the validation phase. Psychometric evaluation showed excellent internal consistency in the total score, breathlessness and activities and psychological domains, and acceptable consistency in the chest symptoms domain. Construct validity was supported by the significant correlation with clinical indices like FVC and dyspnea scales. Importantly, patients reported ease in understanding the translated version. This Hindi build can now be confidently used in Indian clinical settings to assess disease burden, monitor progression, evaluate treatment response in ILD patients, and especially those from northern and central India. It also facilitates inclusion of Hindi-speaking patients in multicentric research. Next original article is titled Assessment of Non-Communicable Disease Risk Factors Among Midday Meal Cooking Staff in Vijaypura Schools, a cross-sectional study. This was authored by Mallikarjun C. Yadavnar. This community-based cross-sectional study evaluated the prevalence of non-communicable disease risk factors among 430 women working as midday meal cooks in government school in Vijaypura, Karnataka. Mean age was 42 years, 97% were females, alarmingly 24.1 were obese, 38.3 were overweight, 32.7 had hypertension, and 3.4 had diabetes. Tobacco chewing was reported by 2%, 60.3% were not engaged in any physical activity. Conclude, substandard dietary habits, blood pressure, physical inactivity were seen as the most prevalent modifiable risk factors within these cooking personnel. Increasing knowledge of NCDs can be important to implement health promotion programs among cooking staffs of midday meals in school, aiming to reduce the economic and social burdens associated with NCDs. Next original article is a comparative analysis of sepsis outcome in patients with autoimmune disease. Sequential organ failure assessment scores, mortality disease response. This was authored by Ram Bhatt. The objective of this study was to investigate predictive factors of sepsis outcome and severity of sepsis using SOFA score in individuals with underlying autoimmune disease, as well as to evaluate the influence of autoimmune disease therapy on sepsis outcome. A 6-month prospective observational cohort study was conducted with 83 participants at a single center. Patients were divided into autoimmune and non-autoimmune groups. The results showed a significant decrease in sex distribution, with 73.2% of autoimmune patients being female compared to 42.9% in non-autoimmune group. Analysis of SOFA score showed the non-autoimmune group had significantly higher mean scores, 6.05, compared to autoimmune group 4.15, that is a p-value equal to 0.006. Septic shock occurred less frequently in the autoimmune group than in the non-autoimmune group, but was statistically significant. Mortality was lower in individuals with autoimmune diseases compared to those without, but lacked significant statistical significance. Different treatment types for autoimmune diseases did not significantly affect mean SOFA scores, indicating no major impact on sepsis outcome. However, post hoc analysis suggested that untreated autoimmune patients had higher average SOFA scores than those on non-disease modifying anti-rheumatic drugs, DMARDs, warranting further investigation into treatment effects. The study concluded that there were significantly low SOFA scores and better sepsis outcomes in patients with autoimmune diseases, highlighting the mitigating effects of autoimmune diseases and their treatment in sepsis. Even though many observed differences, including mortality, septic shock, and autoimmune disease treatment effects on sepsis, were not statistically significant. It highlights the need for further research to confirm these trends and understand the underlying mechanism. The next original article is titled Efficacy and Safety of Edaravone in Amyotrophic Lateral Sclerosis. It's safe but does not stop progression. This was authored by Salil Gupta. In this 6 months observational study involving 30 Indian patients with amyotrophic lateral sclerosis ALS, the neuroprotective agent Edaravone was evaluated for efficacy and safety. Patients received intravenous Edaravone as per standard protocol. Functional decline was monitored using ALS functional rating scale revised. The study found no statistical significant delay in disease progression. The average ALS function rating scale revised, that is ALS FRS-R, score declined by 4.9 points over 6 months compared to historical controls. For the secondary outcome measures, there was significant monthly decline in ALS FRSR score and also progressive monthly decline when compared to baseline. The rate of decline in the first 3 months was the same as in the remaining 3 months. The authors concluded that edaravone infusion does not stop or significantly slow the progression of disease from baseline, but is safe. The next original article is titled Study of Expert Perspective on Administration of Cefodoxime and its Combination in Respiratory Infection, Percept Survey, and it was authored by Ashish Jain. The Percept Survey aimed to capture Indian health practitioners, HCPs, perspectives on the prevalence of respiratory tract infections, RTIs, antimicrobial resistance, AMRs, patterns, AMR diagnosis, and clinical evaluation of cefodoxime and its combination with clavulanic acid in managing RTIs. A cross-sectional survey was conducted using a structured questionnaire in 842 patients. Most HCPs reported RTIs in 26 to 50% of adults and pediatric patients, with most common RTIs including pharyngitis, tonsillitis, bronchitis, and common cold. Streptococcus pneumoniae and Staphylococcus aureus were reported as the prevalent antibiotic-resistant microorganisms causing upper respiratory tract infection and lower respiratory tract infections. Antibiotic susceptibility testing is a common method to detect AMR in patients with RTIs. Among antibiotics, amoxicillin was the most common link with resistance to microorganism causing RTIs. Cefodoxime alone or in combination with clavulanic acid was the most preferred drug for managing RTIs due to its high efficacy, broad spectrum activity, safety, and better tolerability. The study concluded that Indian practitioners find cefodoxime monotherapy and its combination with clavulanic acid effective in managing RTIs compared to early generation cephalosporins and amoxicillin. The first review article is titled Diagnosis of Cardiac Amyloidosis in South Asia, Need for a Collaborative Approach from Researchers and Clinicians. It was authored by Shreya Ghosh. This narrative review explores the under-recognition of cardiac amyloidosis in South Asia, especially AL and ATTR types. Cardiac amyloidosis is a fatal disorder affecting heart, but is also associated with other complications involving kidney, nervous, and gastrointestinal symptoms. Initial diagnosis begins with the assessment of altered cardiac biomarkers in the blood, along with echocardiography and echocardiographic findings. Besides radio-labeled imaging using bone tracers, Congo red staining, mass spectrometry of affected tissue specimens helps to confirm diagnosis. Considering the increased worldwide prevalence of CA in the recent years, South Asian countries, including India, are still lagging behind in the diagnosis of cardiac amyloidosis patients. It is of utmost importance for the researchers and clinicians to jointly embark on the journey of diagnosing CA patients in the South Asian countries. Public awareness must also be initiated by conducting workshops and seminars so that common people can educate about the common symptoms and severe outcomes underlying this disease onset. If these initiatives can be successfully executed by the researchers and clinicians, it would strengthen the diagnosis of cardiac amyloidosis in South Asian population, including Indians. The article calls for South Asian registry initiatives, public-private diagnostic partnerships, and wider access to non-biopsy diagnostics to improve early diagnosis and treatment outcomes. Next review article is titled Tuberculosis and Mental Health, Poorly Addressed Syndemic in India. This was authored by Ms. Sanjita Muneswaran. This review highlights the neglected intersection between tuberculosis and mental health in India, calling it as a syndemic, two epidemics exacerbating each other. Despite the profound interplay between tuberculosis and mental health disorders, mental health remains inadequately addressed in tuberculosis care. Simple screening tools and community-based interventions can facilitate early detection and treatment. Integrating mental health support reducing stigma and promoting collaborations between healthcare workers and mental health professionals are vital to achieving World Health Organization's patient-centered care goals. Addressing this syndemic holistically is essential to improve outcomes for those affected and advance TB care standards in India. The last review article is on organ transplant in India, medical, legal, and ethical nuggets. This was authored by Dr. Ashok K. Taneja. The practice of organ transplant in India has evolved through various phases marked by milestones in medical advancements and ethical challenges. Initially focused on refining surgical techniques and immunosuppressive protocols, organ transplantation expanded significantly, prompting concerns over exploitative practices, particularly involving commercial transactions. The Transplantation of Human Organs Act 1994 sought to address these issues by regulating organ transplantation and legitimizing brain death for cadaver donations. Despite its impact, challenges persist, including organ shortages, continued illicit trade, and limited cadaver donors. This article examines the legal framework, procedural mandates, and ethical considerations governing organ transplantation in India. Thank you so much for listening to JAPI podcast.